next Dr. Archita Sharma for structural and electrophysiological correlation in tubercular serpiginous like choroiditis.
Good morning, everyone. So the study I did under the moderation of Dr. Anup Kelgaonkar is on the structural and electrophysiological correlation in tubercular serpiginous-like choroiditis. So serpiginous-like choroiditis, as we know, is a multifocal inflammatory choroiditis associated with Mycobacterium TB. Multimodal imaging in SLC, it basically enhances the diagnostic accuracy. It aids in disease monitoring and it guides the treatment strategies. So OCT and OCTA can be done to know the structural changes of the disease and the choroidal blood flow. Fundus autofluorescence will help us know the metabolic activity and the damage of the RPE. And the electrophysiological tests like the full field and the multifocal ERG, they will help us in evaluating the global and the localized retinal function. So why we wanted to do this study was because anatomical recovery versus the functional recovery is not very well studied in the infective or the inflammatory conditions, and we wanted to explore that further. We wanted to explore the complementary roles of the multimodal imaging and multifocal ERG to combine the structural and functional assessment for precise diagnosis, monitoring, and management, and to highlight the multifocal ERG potential in the early detection, localized functional impairment as an adjunct to the imaging techniques. So we did retrospective analysis of eyes treated for SLC. We included the eyes which had completed 6 months of ATT and had a good visual outcome at 6 months of 20/40 or better. We excluded any patient that had inadequate follow-up or the documentation was missing. So we had analyzed 17 eyes with a mean age of 33 years. Visual acuity in most of the cases had improved from a mean of 0.7 logMAR at baseline to 0.2 post-treatment. And what we found in the electrophysiological studies was in full field ERG, in 7 cases, both the photopic and scotopic response was reduced. In 5 cases, only the photopic response was reduced, and in 5 cases, again, we had a normal full field ERG. But in multifocal ERG, we had a globally reduced amplitude with certain localized areas of low amplitude, which I'll be explaining further. So this shows the 5 cases in which we saw that only the photopic phase was reduced and the scotopic was normal. And for them, we could hypothesize that most of the patients that had an involvement of the macula only or the posterior pole had mostly a reduced wave amplitude of photopic phase, but a normal scotopic phase. And in all these cases, in multifocal ERG, the wave amplitude was reduced. In another 7 cases, both the photopic and scotopic phase was reduced, the amplitude in both of them. And again, multifocal ERG was reduced. And in 1 case, there was increase in the implicit time on full field ERG. But again, on multifocal ERG, we had a reduced wave amplitude. And when we further studied these multifocal ERG, what we found that was when we did a quadrant analysis for the fundus photos and the ERG findings, multifocal ERG, we could see that the wave amplitudes were reduced more in the areas which had an outer retinal involvement. Like in this fundus photo, the above one, we can see whole of the posterior pole is involved. And hence in multifocal ERG, all the waveforms had a reduced amplitude. Whereas in the lower photo, we can see that predominantly the superior temporal and the inferior temporal quadrant was involved. And when we did a comparison to the multifocal ERG, which is a visual field test that we have, in this interpretation, we can see that in the inferior nasal and the superior nasal quadrant, the waveforms were reduced, and that was corresponding to the area where the outer retinal involvement was more. So to conclude, structural changes in the outer retina, it strongly correlates with electrophysiological abnormalities in SLC. Multifocal ERG, it serves as a useful adjunct to multifocal imaging for detecting the functional impairments not apparent through the standard visual acuity tests. Despite the clinical resolution and a good visual acuity, there can be a residual functional deficit that can be present and that can hamper the quality of vision. Multimodal imaging, it plays a crucial role in diagnosis, monitoring, and managing SLC effectively. And the integration of electrophysiological testing with the imaging techniques, it will improve the disease understanding and will help us in bettering the patient care strategies. Thank you.
Yeah, I think good. Actually, we don't. At least I don't understand much of ERGs, so I won't speak on that. But I was thinking, why not a perimetry would be a good option, no? You know what I mean to say? A perimetry is a cheaper, non-invasive, simple option which would give us a similar sort of a picture that where are the scotomatous areas. You could do a central 10-2 for the macula and a 30-2, you know. So that's one idea came to me.
We actually plan to do it as an extension for the study.
Yeah, you could do it, you know, as a comparative. Yes. That could give you a good idea.
So all the cases which were shown by you, They were quite, I mean, the diagnosis were clear from looking at the case. They were advanced cases. So we know that this part of the visual field is going to go. So what additional finding are we getting? Is it that patients were normal clinically and then we picked up the ERG subnormal? Is it that?
No, so all the patients had clinical findings. The fundus findings were there even on OCT and FF.
So
And
what
fundus
additional
autofluorescence.
information will this give?
We just saw that basically first we thought maybe multifocal ERG shows a global reduction in the wave amplitude. But when we compared to certain fundus photos, then we saw in only the areas where the outer retina was affected, only those areas had an affection of the multifocal ERG and not global reduction was there.
Thanks.
Thank you.